Good evening, everyone, and welcome to the first Monday Meetup. My name is Robin, and I am the Executive Director of SAOT. The evolving COVID-19 situation has created unprecedented challenges for all of us. The response we've received from the SAOT membership has been overwhelming. Tonight's topic is prioritizing OT services during emergencies. So in order to successfully moderate this meetup, we have muted all audio, and during the open forum portion of our agenda, you are able to unmute your own line. You are also encouraged to use the chat box at the right of the screen to post your comments and questions. Please indicate if your question is directed to a specific person on the call. Please take a few minutes to review the ground rules for this Monday meetup. We have several people on the call tonight from a variety of practice areas in many different settings, inside and outside of AHS. The call will be moderated by Robin Scott, President of SAOT, and Rosanna Wagner, Chair of our Professional Affairs Committee. Robin will be leading us in a mindfulness exercise in the last few minutes of the call. So I'd now like to ask Robin Scott to introduce our guests.
Thank you, Robin. Hello and welcome, everybody. So on our call, along with SAOT members, we have Marianne Baird, the ACOT Registrar, who's joining us, as well as Carmen Lazarick, the AHS Practice Director for Provincial Occupational Therapy. And we'll be doing check-ins with both of them for updates from ACOT and from AHS respectively. We recognize that not everybody on the call may be from AHS. So like Robin said, if you do have questions that are directed towards private practice visas, we encourage you to bring up your questions during the open forum and to put them into the chat. Can I confirm that we do have Marianne on the call? Marianne, sorry.
Yes, I'm here. Thanks, Robin.
Awesome. Thank you. And is Carmen also on the call?
Robin, I so far don't see Carmen on the list of participants.
I recognize that some folks may be calling in from their phone line. So if you are on your phone lines, you may need to double check and just unmute yourself at different times there as well. Oh, thanks, Jerry. So it looks like Carmen is trying to get into the call, so hopefully she'll be able to connect in a little while. So maybe what we can do is start with Marianne, if you've got some updates from ACOT for us. I know that you've got lots of great information on the website.
Oh yeah, thanks, Robin.
Has joined.
Oh, sounds like somebody just joined us. I will just reiterate the general information from
Has
Alberta.
joined.
And we support and convey the
Sorry, Marianne, I think you might have gotten muted there.
Angela
has joined.
Hi there. Yeah, thanks for letting me know. I'm not sure why it went on mute on me, but so yeah, just conveying some of the information from Alberta Health that ACOT supports and conveys to all registrants. So in terms of OT services, all continuing care and acute care services are still considered essential services by Alberta Health. And those OT services outside of that are still considered essential services are those services that we suggested some guiding questions around. So you can still see clients virtually, of course, and you can still see clients one-on-one if it's considered critical or urgent, and we had posted some questions around what is considered critical or urgent, and the gist of those questions are preventing people from higher levels of care, as well as if you withhold the service, will it result in somebody harming themselves or others? And some examples that have come up that some OTs have brought to my attention are, one example, an OT was mentioning they were hired to help with discharge planning from hospital. So that definitely would be an essential service. And then for those OTs that are helping kiddos that are not in school now, it would be an essential service if it's preventing another level of care being required. So, and then just some general resources that we've sent out in the last couple of weeks. We've had a lot of practice advisory questions. Really, really happy that people are coming to us with those questions. Questions about virtual practice, question about what is an essential service, question about practice across provinces. So great questions, keep them coming, and happy to answer questions today.
Thank you, Marian. Carmen, were you able to get on the line if you're on the line with us? So it sounds like Carmen might still be trying to get connected, in which case I'd just like to overview what our aims are for today. As Robin mentioned, because this is our first COVID-19 OT, SAOT meetup, what we would like to kind of collaborate on today is gathering and collecting information from you out in the community, hearing about what is working in your practice areas, whatever they may be, as well as maybe some success stories of where we're seeing real advocacy for OT as an essential service, and just general OT practice success stories during this difficult and unprecedented time. Rosanna just popped up in the chat and said that Carmen does appear to be on the participant list. Carmen, welcome. I'll just mention,
Carmen,
if you're on the line, you may need to unmute yourself down in the box along the bottom. Part of this discussion might be the joys of trying to figure out technology as we're going through and adjusting to it.
I just unmuted Carmen.
Perfect.
Nope.
Okay, so maybe oh, is that Carmen? We can hear someone.
Can you hear me now?
Carmen, it's Robin. Are you able to unmute your phone line in the box to the right of your screen?
Robin, what I might suggest if Carmen is having a hard time with audio is perhaps opening up to the general conversation and questions. And then if there are specific AHS OT questions, perhaps we can highlight them in the chat and see if there's a way to invite Carmen to provide some updates that way.
Maybe this is a good time for us to open up that, channel to ask how is everybody doing right now? Whether if you're working in the community or in acute care, whichever setting that you're in, yeah. How are you with identifying OT services during this time? Here we've got some chat boxes. What about supervising aides? Charlene, do you mind clarifying that question a little bit? So you've mentioned,
go
go ahead, Robin.
So what are the risks specifically to providing supervision to those aides as far as social distancing is concerned, or is that capturing your question, Charlene? Great question.
Hi, it's Charlene here. Can you hear me?
Yep.
Hi. So yeah, I've just figured out how to do what I do remotely with kids that I see and the parents that I see, and that's working very well. But there are some now that are saying, oh, well, we're still having the aid either going to be calling in or coming in. So for the coming in, I'm really saying, I don't think that's a good idea. We need to be distancing. But the calling in, I just feel like we're licensed and we're doing our professional, and so we know how to do that. But I have no way of knowing whether the aid is doing things according to some kind of practice guidelines. So I wonder if we're putting ourselves at risk. And then in general, as we're doing remote, what are the risks that we're putting ourselves in, just in a general, like making sure that you're thinking about this and that in terms of our practice, like in terms of liability, in terms of competency, I guess. I'm not sure. So not risks to my health regarding COVID, but risks to my practice, I guess.
I wonder, Marianne, do you have any thoughts that come up with that question from a practice perspective within the college?
Yeah, we had a little bit of this question before, now that people are practicing virtually. And what we've been recommending is that you have more touch bases in place, and that during those touch bases, so for example, whereas before you might have somebody that you would see periodically and you would get updates about your caseload during those one-on-ones, we would encourage you to schedule in those one-on-ones on a more frequent basis. And if you want to mitigate risk, make sure that the therapist is contacting you either virtually, well, virtually it would be that in that case, contacting you, the assistant, so that if there's any change in the progress at all, or if they're planning to make any gradations to the treatment, then you would make sure that they contact you to give you information about that before you give the go-ahead. So it's a bit more closer supervision than in past, so you'd have to be in communication more often, but that would mitigate some of the risk that people, I think, are describing.
Thank you, Charlene. Does that help answer that question?
Thank you. That is helpful. And then
Has joined.
if like we're using software that, you know, we've checked that the end-to-end encryption and that, I guess, is it enough for us to suggest that, and then it's up to the parents to, you know, if they end up using Facebook Messenger, then, you know, am I putting myself at risk if I haven't said you can't be using that?
You are. The Office of the Information and Privacy Commissioner hasn't loosened up their requirements at this point anyways. They're still requiring that health information be in an encrypted format.
I see a couple of other questions that have been put up. From Andrea, your question of, I'm still trying to work out what I can and can't offer virtually. It's a new area for me.
Has joined.
Other reflections from school-based OTs. So if there are some school-based OTs on the line, do you have any feedback for Andrea on what you've been managing virtually?
Hi there, this is Frankie. I'm also a school-based OT in Edmonton. It feels like for us, things are kind of changing every day in terms of what our managers are telling us. For now, I'm alternating between providing sort of like weekly activities and ideas to provide to my classroom teams, and then trying to start to schedule meetings and conversations with parents and children over video chats if possible. However, we're still trying to figure out the best way to kind of contact those families without overwhelming them, because the families that we tend to work with are the ones that also need the most supports in all areas in many cases.
Mm-hmm. Are there any
Frankie,
other?
oh, sorry. Frankie, I was going to ask you a question with regards to kind of offering, you know, connecting with them. Are there, within your organization, is there more kind of a telephone touch base, or is there more of a virtual health opportunity that might be, you know, an option for school-based OTs?
So within our organization, I guess we have agreements with Microsoft. So a lot of the stuff is kind of using their program. So they have a video chat option similar to like Zoom that's out there. But we've been told that we can't use Zoom because of you know, privacy concerns and all that from our district. So we are using the Microsoft version of that, which is called Microsoft Teams. We also have access to Skype. And sort of last case, some of the teachers and stuff have been calling parents on their phone lines. So that's an option for us as well.
I see. Thanks, Frankie. And I guess I was going to ask Robin from the virtual health kind of meetup, were there any strategies and or resources there from the last meeting, Robin?
Which Robin? Sorry.
Sorry, Robin Talaski with the virtual health.
Yes, thanks, Rosanna. We do have a resource package that we have compiled. We did have a webinar last Thursday that was well attended. It was a bit rocky technology-wise, but we do have some resources and also a few people who put their names up for mentorship, including Charlene Wright, who is actually on the call tonight. So I'm happy to send that information out to anyone. If you just want to shoot me an email at executivedirector@saot.ca.
That's great. And so Frankie also had a question for Marianne on the chat box asking, Marianne, can you clarify a bit more on your statement about OT services to students being considered essential if it prevents another level of care needing to be provided? Can you give an example?
Sure. Yeah, I was just trying to get to the chat box and I'm to type an answer to that one, and I'm having trouble seeing the full chat box window. So glad to provide a verbal answer. So the considered essential in terms of being able to still see the person in person is relates to another level of care would mean, for example, if you provide the service, then the person isn't finding that they need to take the kiddo to their family doctor or to emergency, for example, if they're having severe issues. So that's what's referred to with another level of care.
Frankie,
Has
does that
joined.
answer your question? So I'm just going to move on to a question from Jackie Whitford. Jackie works in acute care, and since there is no OT in home care right now, the challenge is to make the best possible discharge without the home or follow-up. The plus is we are weighing the risks and getting these clients home, which is considered safer than the hospital environment at this time. We ensure the family is involved and offer phone follow-up. Perfect. Thanks, Jackie. That sounds like one area that there is a success. I wonder if other people are also finding that that's helping for themselves. Is anybody perhaps having a challenge in that area as far as providing follow-up post-discharge? Or knowing what that might look like?
Question for you, Jackie. Do you find that there is time for you to do the phone follow-up after the client is discharged home?
There is. It's just not always ideal. What I find is the challenge is just that, we always like to have them be there and be safe and provide as much rehab as we can before they go home. And I think what the challenge is allowing it to happen, is to understanding that that risk is still better for them to go home, even though they might not be fully rehabbed, versus staying in the hospital. And I think
For
that's
sure.
where the challenge comes in. I can do the follow-up, but it's still that rehab part that, they're not quite ready to go home, but we're weighing those risks.
Mm-hmm. And I'm just curious whether if there's a home care OT that can maybe speak to the other piece of when a client is discharged home and, what the follow-up looks like from there.
Hi, this is Dawn Witnack. Can you guys hear
Hi,
me?
Dawn. Yes, we
Hi.
can hear you.
So I am not a home care OT, but I am a private practice OT that does case management support. And as I've talked to Robin about, what I'm noticing is because there is this desire to get people out of these facilities, that I'm being contacted by family lawyers who are funding these files to assist these people transitioning home. So I'm trying to see the home before they get discharged to prevent that contact. We'll go and see them if I need to, but it's a work in progress, but it's something that's developing. And this is why I reached out to SAOT about getting access to support to get some PPE, because we have no other, in private, we have no other resource to do that. So that's one thing I've noticed.
Thank you.
Hi. Oh, can
Go
you
ahead.
hear? Sorry, it's Sherry. The phone lines aren't working, but I called in on the computer here now, so hopefully my mic is okay. I was going to say in our acute care, because we're still in that sort of pre-surge, we are trying to get our staff to have more ability to be able to connect with families remotely, because we're now sending people home who really don't have an idea how their loved ones are functioning. So we are in the process, hopefully, of our foundation getting more iPads, and then we're trying to figure out the whole platform, whether it's Zoom, or even if we don't get extra iPads, when people have their own phones, being able to use their personal phones to potentially connect with their family members, so their family can see how they are mobilizing. We can do that education piece. We can sort of make that that really intentional effort to connect, so they do have an idea of what's happening when they get home.
That sounds great, Sherry. Thanks for sharing. I know Andrea, moving on to the next question, did ask, are OTs doing virtual evaluations? Anybody out there sharing or doing virtual evals out there?
Hi, Robin. It's Lindsay Coe.
Hi, Lindsay.
So hey there. I work in the private practice area of women's pelvic health and mental health. And yes, we are still virtual evaluations and just doing as much as we possibly can in the interview section as well. Then also trying to do observational. So obviously I'm working mostly with adults, but we also do have pediatrics in our practice. And then just trying to do anything that we can evaluate with competency across a telephone or a video chat option. And I just wanted to mention that if people are using Zoom, they have had those problems this week, but they also need to make sure that you're using Zoom for healthcare, or that your agency, if it's purchased Zoom, is using the Zoom for healthcare option, because the free options are not privacy compliant. So
Thanks
just a heads up for everybody there.
Yeah, I think that's one thing that's popped up in the question section, chat section quite a bit, making sure that Zoom is secured. So having that healthcare Zoom option.
Yeah, I know a lot of the physiotherapists, because there's been a large influx in my area of practice of physios in virtual practice. They are using Doxy, DOXY.me, and Doxy does meet our privacy requirements as well, and it is free. Or no, I shouldn't say it's free. $35, I think it was, American.
Lindsay, would it be okay if you actually put down the platform on the chat box just for others to maybe copy that down if that's an option for them?
Absolutely. And I think that there was a pretty good thorough resource like that Robin had talked about earlier too with SEOT. So going back through that option and emailing Robin is a really good option.
Great. Thanks so much. All right. So I'm just kind of going through this chat box right here to see what we've missed. Or questions. So my employer has indicated that Zoom is less secure than Google Meet, for example. Yeah, there's just a lot going on right now with regards to virtual platforms, and you really need to make sure that it is secure for privacy and health reasons. I'm not sure, Marianne, if you can speak more to that. I know that there was a document from ACOT that was produced.
Yeah, it just is about ensuring that there's end-to-end encryption, so encryption at both ends, and that is a Information and Privacy Commissioner requirement, not specifically an ACOT requirement.
Thank you.
I see that Carmen's updated that she only has audio on her phone. So don't think, unless, Carmen, have you had any future success in unmuting?
It's Robin Talaki here. If I know what Carmen's number is, I can unmute her myself if she's not able to. It would be good to hear from Carmen.
Mm-hmm.
Just trying to catch up with all of the comments on the chat box right here.
Just while we're doing that, Rosanna, it's Robin again. I'm going to unmute everybody and hopefully allow Carmen to speak. So if everybody could please just remain as quiet as you're able with background noise, and I'll unmute everyone so that Carmen is able to chime in here.
Thanks, Robin.
Hi, can you hear me?
Yes.
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 Hi, Carmen.
Sorry. I'm so sorry, guys. My AHS laptop does not have a built-in mic, so I cannot speak through my computer. I have to use my audio or my Skype set.
We can hear you, Carmen. You're just a bit echoey right now.
Yeah, I totally hear that too. I'm really echoey. Just 1 second. Let me see if I can fix that.
Carmen, what's the first 3 digits of your phone number?
Is that better now?
Ooh, much better.
Much better.
Okay. Yeah, I'm calling in from my Skype for Business, so it's not a regular number. But if you want, I can join on my regular phone and you can. This sounds okay for now, though. If everybody just stays quiet, is that okay?
That does sound good.
Okay. Yeah, or Sherry, if you're on Skype, can you maybe put my Skype phone number in the chat box if you're able to find that? You know, my Skype number. But anyways, I'm so sorry for the technical difficulties that I've been having, and thank you so much, Robin, for inviting me to come and be part of this meetup tonight. And I hope to be able to join for the other sessions later in the month as well. So I've been listening in, but somewhat distracted with my real attempts to join. I can say for Alberta Health Services, there's lots of people on the line that will be able to speak in further detail or if questions come up. But in general, we are just dealing with, I think, what everyone is dealing with right now in terms of just tons of information every day, every half day, and really every hour. Some of the information about PPE use and redeployment and practice in general changes is being updated very regularly. We're developing a lot of resources, and we've developed an open SharePoint site to be able to compile allied health resources all in one spot. So that is just up and running as of the end of last week, and we have yet to load lots of the occupational therapy specific resources onto that SharePoint site, but we are working toward that. In terms of the provincial work for occupational therapy to support OT, really the focus right now is on providing operational leaders with an outline of skills that they can expect an occupational therapist to come with in the process of redeployment. Because through redeployment, we expect that there will be OTs working for non-allied health managers who maybe don't have a great sense of what OT has to offer in acute care, for example. So we're putting together a document, one document sort of for each of the allied health disciplines. And so the OT section of that will outline the key skills that we want OTs to sort of be known for and be expected to be able to do in acute care. Through that process, we are now translating that into where do we need to provide education. There's already lots of great training and reskilling that's happening or upskilling for OTs across the province, but we're looking at doing some provincial sort of coordination of that because so far the training and education are happening site by site and team by team for the most part. There are some webinars and things that are being organized, but a lot of the training that is going to be needed in some of the rural areas or in about a month from now need to be coordinated. So we're working towards that. I'll just pause there and see if there's any questions. I think Marianne already spoke to the essential services. Yeah, go ahead.
Hello, do you hear me? This is Tanya from the Edmonton Zone.
Hi, Tanya.
Oh, great. I work in home care, and so I am with AHS and trying to navigate and understand, what I should and shouldn't be doing. And so after sort of reading what's on our college's website, I had a little bit of confusion about because it says that home care is exempt, but then it's not clear if we should be, limiting our contact to only, those certain circumstances sort of listed below, or should it be business as usual, continuing to prioritize based on greatest need, that kind of thing. I don't know if anybody can speak to that to clarify that for me.
Hi, it's Marianne. My understanding is it's home care is still listed as a service because it prevents seeking of a higher level of care. So it would be business as usual.
Okay, so that there's been a lot of discussion in our network trying to get clarity on that. So a lot of therapists, well, I shouldn't say a lot, but some, the ones that I know of, were sort of limiting our visits because we're really not clear on what we're allowed to do. And we don't want to contravene any orders. So,
Yeah. So I'm basing that just on Alberta Health's site that says that home care is considered essential. So we've included all of home care OT services in that. I will send that out in our next e-news, that clarification.
meaning that anything we normally do, we can continue to do.
Mm-hmm. And I'll just check my understanding that pretty much what you do is helping people stay in their homes and does prevent another seeking of another level of care. Have I got that right?
Yeah, there would be certain circumstances, for example, where we do a lot of equipment for people. So if they already have some equipment they're borrowing and it's working well, we might, through this, COVID pandemic, decide to just leave them as they are and to limit the in and out of their home. So if it's not essential to be done right away and it can be postponed, then we would probably choose to do that. But then there's other folks who are needing some other help in some respects, and we've sort of asked ourselves the question, if they don't get the service right away, will they go to emergency? And if we say, well, not necessarily, then we're sort of questioning whether we should go in and do it, even though it's something we would normally do. So our managers are concerned about the backlog of work that's going to happen, and then people will not really be able to get the service that they need. People might be dying on our wait list, not getting what they need.
So those are excellent examples of judgment calls. So totally support the judgment call of if the equipment is working well, you may put that one off and in favor of seeing somebody that has a more urgent need. For the next level of care, doesn't necessarily mean just emergency. It could mean seeking services from a physician or a primary care network instead. So that's another way to consider it. And yes, definitely if they're going to seek out care from another provider, including their family physician's office, if in the absence of the OT service, then that puts more pressure on those offices that may be needing to see patients for other reasons. So those all factor into it.
And then the other big thing that we do is a lot of fall prevention kinds of things. And so again, whether they receive the service or not, they may or may not fall, but they're at a higher risk of falling. So at least I feel like we should continue to be doing that work. Would you agree?
I would agree. Yeah. So preventative is an important area, and these are judgment calls that I don't imagine will get really clear direction from Alberta Health on whether preventive items are or aren't essential at this point. So I would say just use your good judgment, and what you're describing to me is excellent judgment. And just continue to triage those most in need, and consider those that can be put off, the ones like you described where the equipment and the strategies in place are working well enough for now.
Thank you so
Marianne,
much.
can I add to that? It's Carmen. Maybe I'll just add to what Marianne has said. I absolutely agree. What I can tell you is that I just had a provincial update today from our executive leadership team, and their two top priorities right now in terms of COVID-19 response for the organization are specifically to home care and congregate living, and in terms of the risk of the infection rate, or the transmission rate, I should say. So I think you can expect to work closely with your managers, and that there will be updates and probably changes to how we are delivering services, and either redefining or just further defining essential services as we move into the coming weeks and months.
And just adding to what Carmen mentioned, ACOT would fully say that we wish to rate as employer, as well as Alberta Health, and where we'll have the more detailed implementation plans that ACOT will support.
Sorry, Marianne. I think
Sorry, we were just getting a bit of backlog there, or back feed. So I'm wondering if, Marianne, if you don't mind just repeating yourself on that, the last couple points you made.
Yeah, just adding on to what Carmen was saying, the AHS as an employer and other employers will have more detailed information on what is considered essential, and ACOT fully supports the employer's direction on that.
There was also a question for Carmen from Taylor on redeployment. Who does this apply to, i.e. what areas of practice, and what can we expect?
Can you hear me now? Okay, great. So, oh gosh, I'm getting that feedback again. Hang on.
So if everyone except Carmen would please mute
Go.
their lines. Thank you.
Yeah, so redeployment is a term that refers to people already employed by AHS that are being moved to other areas, whereas deployment are the hiring of currently non-AHS staff and then deploying to where we need them. So for redeployment of AHS staff, the main target area is to acute care, is my understanding, at least for right now, is to acute care, critical care areas, as well as to HealthLink. And I believe there were also some people being asked to redeploy to the workplace health and safety, but that might be more some managers or other non-clinical staff. So does that help? It's going to be mostly to acute care at this time.
This is Rosanna here, and if you don't mind, I'll just add in, I'm from Edmonton zone, and we have a team of OTs and SLPs in kind of the community health, and we are potentially being trained for swabbing at assessment centers as well. And just because we are part of the community health services with public health, and so we are preparing ourselves for actually, assessment centers.
Thank you, Rosanna. I should have definitely added that. Yes, doing the NP swabbing is another area where SLPs and OTs are either already redeployed or are receiving training and considering redeployment. I'll mention this because I'm excited about it, but I can't say anything official yet at all. But we're having a meeting tomorrow to start talking about redeployment to a rehab service that would be virtual. So something like HealthLink, but being able to provide allied health or rehabilitation specific information and virtual practice. So I'm not sure yet if this will happen, but these are the types of things we're talking provincially about to be really creative and really rapidly innovative to try to address the huge gaps that are being created by OTs not doing what they normally would do. Like as we start to stop services or pause services, at least for a period of time, we know that there's a gap created for those with chronic illness as well as with new onset. And for patients who are currently receiving services and might no longer be able to do so. So we're hoping to sort of bulk up and really replace at least some of that for the patients that really need it, or individuals and families who really need services during the time of the redeployment of staff. So hopefully more to come on that, but I guess why I'm mentioning it to this whole group is that there's probably going to be some future opportunities for work within AHS that maybe don't exist right now. And so we need to work really closely with operational managers to think about redeployment, tentative planning, as well as then long term, we might have some changes in the options for redeployment.
Sorry, I just muted myself. Carmen, there are a couple more questions on the chat box for you with regards to has the SharePoint link been shared to HSOTs? Is it possible for you to the link to be resent? I work in mental health in AHS and I haven't seen a SharePoint link yet. Carmen, are you on the line? Can anybody hear me?
I can hear you.
Okay.
Now I can talk. Sorry, every time you mute and then unmute, I have to just mute again my computer. So yes, I can share the SharePoint link. I literally have an email ready to hit send on that I just have to wait for one more confirmation before I can send it. It will include an allied health specific resource for virtual practice, as well as the link to the SharePoint site. The SharePoint site just went live on Thursday last week with the physiotherapy focused practice-wise session that was also recorded. So anyone that missed it and wants to listen to that, there is a recording for that. So feel free to email me if you want the SharePoint site right away and or a link to the practice-wise session right away. I'd be happy to respond to that. And the virtual practice resource for allied health professionals is what I'm waiting on final confirmation before I can send it. So hopefully in the next day or so.
I'm cognizant of the time, and Robin Talaski did mention that if there's some more questions, we can push the meeting back until 8:30 or so. I saw two new questions from Andrea and from Frankie. Andrea, you suggested that SAOT can potentially offer support to OTs around redeployment in general for private practice and school-based OTs. Are there particular areas that you feel would be useful around that, or just guidance about what redeployment may look like? I'm not sure if Andrea has sound, but you've been using the chat, so if you've got clarification, maybe you can use that too. And then Frankie, I see you've got a question for Andrea about redeployment within school district OTs to acute care and critical care. Have others seen that? I know for me personally,
This is Andrea talking. I'm not sure if you can hear me.
Yep, thank you.
Oh, excellent. I'm a school-based OT that is not employed by AHS, so I'm employed directly by the school district, and I work with children from 2.5 years to the end of high school. And so there are several different programs that cover those different years. And I heard earlier on in school shutdown about possibly OTs and other allied health would be doing home visits, but that sort of, went away fairly quickly. So in terms of redeployment now, what we're talking about is looking at ways of providing an online virtual support to teachers. And that is looking a lot different than what I'm used to doing. I'm having to learn about making videos and technology and, YouTube and all kinds of things in a really extremely rapid time frame. And also the stress related to this sort of quote unquote redeployment that we're seemingly experiencing. So I don't know if that gives any sort of substance to my question, but the idea of redeployment and having to do something completely different than what we thought we were doing a month ago, generally, I think is something that we probably can explore a little bit more.
Absolutely. That's certainly an area that continues to pop up for many OTs. Having seen through social media feeds other OTs across Canada that are posting different videos on or learning links through the different provincial societies, that is certainly something that I think across Canada we're trying to figure out. And I do feel that that is a role that SAOT can support. And I'm sure Robin would agree that those are maybe some resources and links that we could ensure that we share with SAOT members and OTs across the province. But I suppose as it's 7:54 by my clock, I'd like to just do a check-in again to see if there's any additional questions or things that haven't been addressed today that people would like to talk about going forward and in the future, knowing that, as Carmen already mentioned, we consistently are getting updates daily, whether it be within AHS, the school districts, private practice, across Canada just generally. But if there's something specifically that people would like to ask today before we wrap up, I'll open the chat or forum.
Hey, Robin, this is Frankie again. Just wanted to kind of share, like Andrea, we're both working in school districts. It's not completely kind of COVID-19 related, but it is kind of related to sort of the budget stuff from the government that we're seeing. And I don't know if this is kind of the right time to bring this up, but I know that we are planning for like a significant shortfall across the province in terms of funding provided for kids with disabilities or regarding PUF funding in other areas. And I was just wondering, within our kind of school district, we got like an OT advocacy committee going, and we're just wondering if that is something that SAOT is looking into and trying to figure out if we can kind of raise our voices, I guess, to those people that would be able to kind of see if there's any changes that can be made to that.
Absolutely.
Robin here. I would suggest that Rosanna should respond to that from our Professional Affairs Committee.
Yeah, thank you, Frankie. So Robin Talaski sent out an email a few weeks ago asking for feedback with regards to, the Alberta, some of the funding changes and the cuts that was proposed and probably were taking action, and then COVID hit. And so really we did talk about this and with regards to how we can support OTs during this very, very difficult time, especially once COVID maybe settles down sometime in the future. We have an action plan with regards to revisiting that and to try to support our school-based OTs. How is that going to look? We are not fully sure, and that's why we sent out the email to gather information. And so thank you so much for those who responded and gave us some really practical ideas to go along with. What we are going to do is in the summer, the Professional Affairs Committee, which is a very small group, we are going to meet up and actually talk about what small action plans that we can take to support our SAOT members. That being said, this is my plug out there. If those of you who feel very passionate about this, maybe your advocacy group can come and join our professional affairs committee so that we can be a stronger and more united voice as well. I hope
Yeah,
that answers your
Rosanna.
question a bit, Frankie.
Yeah, no, that's extremely helpful. Thank you. I mean, that sounds like a fantastic idea. I don't know if I'll have a job in the summer, but I would still very much love to be a part of that of those discussions that you're having. And I don't know how much I can offer in the meantime as I look for jobs, but I would be happy to kind of hear what kind of discussions are happening.
For sure. And if it's okay, Frankie, can I reach out to you and then we can potentially talk further along, maybe in early summer once we're more prepared to discuss that issue. I think right now our focus has been primarily based on COVID priorities. So
No, thank you very much. I understand completely.
got your email. Thanks.
So I'll give a couple of seconds for, well, a minute to maybe have last comments, questions before we move into progressive muscle relaxation. And the reason we chose to do progressive muscle relaxation is certainly at this point in time, I don't know about you guys, but I've definitely had to practice my mindfulness and being present in the moment and not getting swept up in everything else that is going around, especially as we're continuing our day-to-day jobs and routines. So I'm going to pull up this resource that I've used in my own practice. This is from therapistaid.com. It's just a simple progressive muscle relaxation script. The reason I like this one is because it is quite helpful for me to get into my body, recognize that progressive muscle relaxation might not be for everyone. But if you're still on the line with us, I invite you to get yourself into a comfortable position. Perhaps you may choose to close your eyes. I invite you to just notice your breath. And as a warning at the beginning, if at any point as we're doing this exercise, you're noticing that there is muscle strain or that you're sore in any way, I encourage you and invite you to back off and just maybe focus on your breathing instead. So once you're in a comfortable position, begin by taking a deep breath and noticing the feeling of air filling your lungs, and hold your breath for a few seconds. Release the breath slowly and let the tension leave your body. Take in another deep breath and hold it. Again, slowly release the air. Even slower, take another breath. Fill your lungs and hold the air. I invite you to slowly release the breath and imagine the feeling of tension leaving your body. Now, move your attention to your feet. Begin to tense your feet by curling your toes, holding them tightly, and paying attention to the feeling of tension. Release the tension from your lower legs. Oh, sorry, lost my place. Release the tension in your foot. Notice the new feeling of relaxation. Next, begin to focus on your lower leg. Tense the muscles in your calves, hold them tightly, and pay attention to the feeling of tension. Release the tension from your lower legs and notice the feeling of relaxation. Remember to continue taking deep breaths. Next, tense the muscles of your upper leg and pelvis. You can do this by tightly squeezing your thighs together. Make sure you feel tenseness without going to the point of strain. Release and feel the tension leave your upper legs. Begin to tense your stomach and your chest. You can do this by sucking your stomach in, squeezing, and holding the tension. Releasing the tension, allow your body to go limp. Let yourself notice the feeling of relaxation. Continue taking deep breaths, breathing in slowly, noticing the air as it fills your lungs. Hold it. Release your air, feeling it leaving your lungs. Next, tense the muscles in your back by bringing your shoulders together behind you. Hold them tightly. Tense them as hard as you can without straining, and keep holding. Release the tension from your back. Feel the tension slowly leaving your body and the new feeling of relaxation. Notice how different your body feels when you allow it to relax. Tense your arms all the way from your hands to your shoulders, making a fist and squeezing all the way up your arm. Hold it. And release from your arms and your shoulders. Notice the feeling of relaxation in your fingers, your hands, your arms, and your shoulders. Notice how your arms feel limp and at ease. Move up to your neck and your head. Tense your face and your neck by distorting the muscles around your eyes and mouth. Release the tension, and again, notice the new feeling of relaxation. Firstly, tense your entire body, or finally, tense your entire body. Tense your feet, your legs, your stomach, chest, arms, head, and neck. Tense harder without straining and hold that tension. Now release. Allow your whole body to go limp. Pay attention to the feeling of relaxation and how different it is from the feeling of tension. I invite you to begin to wake up your body by slowly moving your muscles, adjusting your arms and your legs from where you've been sitting or lying, stretching your muscles, and open your eyes when you're ready. And thank you all for participating. Charlene, I see tip, eye health, look to the distance often throughout the day, look at the birds, etc. Thank you for that tip. One tip, one of my, oh no, Laura, I'm sorry that you fell off your chair. Another tip that I might suggest for folks if you get a chance to be outside, one that one of my supervisors told me is look up at the horizon, look up at the clouds, and take a moment to appreciate the visuals that we have. As we wrap up today, I do want to let everyone know that we will be doing another meeting April 20th, same time from 7 until 8. If you're able to join and would like some new updates as a way to stay connected and hear what else is going on, we would love for you to join us. And Robin's just prompting everyone who is still on the line, if you can, leave us a rating of 1 to 5 in the comments chat, of maybe what we can improve or how much you enjoyed today's session. We really appreciate everybody's feedback, and we encourage lots of questions during this time. And thank you again to Marianne and to Carmen for participating and helping field all these questions.
Thank you.
Thank you very much, Robin and Robin.
I'll just leave the chat open for a few minutes so people could continue to just leave us some comments, and we're all learning, so if you have suggestions of how we could improve the next Monday meetup scheduled for April 20th, that would be great. Thanks so much.
Thanks, everyone.